That's right, yeah. So I actually did a diploma course in Temasek Polytechnic, and then I went over to Australia and I did my bachelor and then did undergrad and did a postgraduate as well. And I mean, specializing in nutrition and dietetics. So it was a long process, but I really enjoyed every step of it.
Okay, so after you finished up your studies, right? Where did you start?
So I first worked in Health Promotion Board. I worked for the government. I was working a lot with food manufacturing. I helped food manufacturers come up with healthier recipes. And you know that logo, the Healthier Choice symbol. So I was part of that group that actually was pushing it to food manufacturers. So that's why I learned a lot from there. So after that, I went to work in the private sector. I went to work in Gleneagles and Mount Elizabeth Medical Centres. So I did a lot of clinical cases. And after a couple of years doing that, I decided to start my own practice. So in 2005, I started Aptamar Nutrition. There are several food groups. You know, there's the carbohydrate-based food groups. There is the protein, and there's fruit and vegetables. No food groups can replace each other. So you need to make sure that you eat a little bit of those, of each of these foods in the right quantities every single day.
How do you lose weight in a very practical way without micromanaging every aspect of the diet?
So weight loss, which is actually quite close to my heart, it's about consistency at the end of the day. It's about discipline and consistency. But most importantly is knowing what to do, because there's so much information out there, people telling you to go on low-carb diets, going on keto diets or paleo diets. But most importantly, you need to know that it's all about balance as well. I mentioned about the food groups, you know, about the carbohydrates, protein, and your vitamins and minerals and dietary fiber. You need to get a balance of that before you actually think about whether you can lose weight or not. Because if you do very extreme diets, some of the diets just promote no carbs at all, or very high fat, or very high protein. When you don't strike the correct balance, yes, you lose weight, but it's not permanent. So the way I teach my patients to lose weight is all about sustainable weight loss. That means you can actually make sure that you lose the weight and you maintain that weight loss. I think that when you try to follow any structured diet, you will lose weight, for sure, because you're just more aware of the foods that you're actually eating. But people like to attribute that weight loss to the name of that diet. But is it sustainable in the long term? I know a lot of people who have done a keto, lost a ton of weight, but because it was unsustainable, because you need your carbs to function, they go back to carbs and then they overeat the carbs again. So they do lose weight, but then they put it back on again because they don't know how to incorporate carbohydrate healthfully back into their diet. They just end up eating too much carbs. And so at the end of the day, quantity versus quality, right? And at the end of the day, it's still portion control. Saturated fats, as we talked about, is considered more of the bad fats, because really there have been a lot of clinical studies to show that if you have a lot of saturated fat in your diet, it increases the risk of some cancers, breast cancer, colon cancer. And then there's the other kinds of fats, which we call the unsaturated fats, broken up into mono and polyunsaturated fats. So these fats, if you take more of it, it actually improves your cholesterol level. So they are good fats and bad fats.
Would you say that the average person who eats a balanced meal, right, would taking a generic multivitamin, right, would it be helpful for him?
If you're eating a balanced meal, meaning that you take your servings, your recommended servings of fruits and vegetables today, which is 2 and 2 a day, then you probably don't really need a supplement. But having said that, 1 in 4 Singaporeans meet this 2 plus 2 recommended intake. That means 3 in 4 Singaporeans don't actually meet that. So for those that actually don't meet the recommended intakes, I think they probably would benefit from a supplement. Yeah. And also some other nutrients that might be of concern would be things like calcium, which is what I do recommend frequently to most of my patients who I feel that they don't take enough calcium in their diet. The other thing I would also recommend is also fish oils.
What you've been touching on is theory, right? So the ultimate make or break of most diets or transformations from normal eating to healthy eating is the execution, right? So what are some practical pointers, right, that you can give in terms of how to manage this transformation to healthy eating?
I would say make small changes first. Identify which are the changes that you're able to make without too much interruption in your daily lives. Okay, once you make the small changes, maintain those small changes and then make bigger changes. Because I'm very sure that even the small changes would have a huge impact on how you feel and how you look. And that's going to be your motivation factor for you to continue to continue all the changes.